According to a 2024 survey by the Vision Council, nearly 70% of adults in the U.S. need prescription eyewear. Glasses and contact lenses can do the trick, but our next guest can make it like it never happened, almost in the blink of an eye. Dr. Paul Mann is a cataract and refractive surgeon with Mann Eye Institute. His patient, Robin Eddy, can now see clearly with her own naked eyes. All right, Dr. Mann, I mentioned that about 70% of adults need prescription eyewear. I would be willing to bet a lot of people are just compensating and making do and don't even realize they need it.
Absolutely.
Yeah. So how often should we be getting our eye exams?
The American Academy of Ophthalmology usually recommends annual eye exams for adults in the United States.
Yeah, so every year at least. And in that case, you find out whether you do need something. And then the other thing is you find out if you might even have some kind of eye disease or something that you all can interrupt.
Absolutely.
All right. Mann Eye Institute has a long history in Houston, started by your dad, and he was actually a great pioneer in this industry as well.
Yeah, my dad started in Humble, Texas in 1977.
All right. So
I was in first grade.
You were in first grade. All right. So you grow up, you think you're going to medical school. Oftentimes kids will like go up, I'm not going to do what dad did. And then you come back around to what dad did. What changed your mind?
I originally wanted to be an orthopedic surgeon, but that just didn't work out for me. It wasn't the right cup of tea for me. Yeah. So
in fact, your dad said,
my dad kept saying, the eyes have it, the eyes have it, the eyes have it. And for me, he was right.
Yeah.
I came around at the end.
All right. You specialize in refractive surgery, blade-free LASIK since 2004. You actually had LASIK yourself. And we were talking during the break how it's interesting. When you wear glasses, you think you're seeing well. And then when you have LASIK, all of a sudden you're like, the colors are much more, everything you're seeing really well.
Yes, I remember after my LASIK seeing the individual leaves on trees for the first time in years.
Yeah.
Yeah.
Okay. The Mann Eye procedures that you all do, you have several that are available. But I had LASIK 25 years ago, and the same thing you said, seeing the leaves, seeing the colors, all of that. Why people consider LASIK? All types of reasons. One reason you were considering it was why?
I had been wearing contacts and glasses for 12 years, and I was tired of getting up, putting them in, taking them out before bed.
Yeah.
I was getting makeup in my contacts, and I just wanted to get up and go.
Yeah.
I was sick of it all.
Yeah, I was with you. I was wearing my glasses since third grade, and then I went into TV. My mom said, let's dump the glasses, let's get yourself some contacts. And I had the contacts, but then if there was a allergy day or an eye infection, you still had to have the backup on the glasses and stuff, right? So who can get LASIK? Who's a candidate for that?
Typically, it's for people that are anywhere from 18 to 45, 50, even 55. And some patients get it as a fine-tuning mechanism after cataract surgery. So really, there's a large age range of patients that, for LASIK.
Yeah, when I got LASIK, I remember people would ask me a couple of things. One, they'd say, oh, I have an astigmatism, so I can't get it. That's not
true.
Yeah,
that's absolutely not true.
Yeah.
Astigmatism has been readily treatable by LASIK since, I believe, 1998.
Yeah, because I have astigmatism.
Yeah.
The other thing is that, our eyes, if you're working on my arm, I'm like, okay, have at it. But the eyes we're hypersensitive about, right? If we have other problems, at least we want to be able to see. I want to make sure people understand this. That's the other thing people would ask me, go, weren't you scared? No, this is a highly effective and highly safe procedure.
It's a very safe procedure, no question.
Yeah, millions of them are done.
Yes.
Okay, so when you got it done, like I was saying earlier, you think you're seeing with your contacts even or your glasses, but you open your eye and what happened?
I remember the next day when I got in my car, just being able to see the street, all the colors, the trees. It was the first time I had seen the street like that.
Yeah.
It was wonderful.
Yeah, how long did it take you to forget that when you woke up in the morning you didn't have to put a contact in or push some glasses
some weeks.
up?
I kept doing the glasses thing.
Yeah.
It takes about a month, I think.
Yeah.
The other thing people ask is they go, did it hurt? I felt absolutely nothing. Sometimes people might feel pressure, but I felt absolutely nothing. You take care of that.
Yes, we definitely give people Valium to relax them and encourage them to go home and take a nap and just sleep it off.
Yeah. All right. You're young. But when I had mine done, it was about 25 years ago. That's when I was young. And then we start turning that corner where your eyes, you're like going, well, now what's happening now? You can take care of that.
Further and
Yeah,
further
that's
away.
right. That's right. I need a longer arm, right? There's a thing called refractive lensectomy.
Yes. That is essentially cataract surgery before you have a visually significant cataract. So we go inside the eye, we remove your lens that's not functioning like it used to, and we replace it with a lens that allows you to see it both up
Yeah.
close and far away without glasses.
Yeah, okay, because like a lot of people understand what this is right here. You have them all over the house, everywhere.
Readers.
Yeah, you got them in the car, you got them in the bedroom, you got them in the kitchen, you have them everywhere. And so you can dump those, get rid of those, and you can see well. All right, take us through the process. We come in, and obviously you get a baseline of what's going on, and it's also extremely accurate in terms of measurements and all that type of stuff.
Absolutely. So we do a thorough evaluation to make sure you're a good candidate for refractive surgery first and foremost. So if you end up having glaucoma or retinal problems, we may not recommend surgery for you. We're only going to do surgery on patients that are going to have good outcomes.
Yeah.
So we have to do a thorough exam and figure that out, and then we come up with a plan, figure out what you're really looking for, and we come up with a plan and get you set up for the treatment.
Yeah, and Mann Eye Institute, that word institute means a lot because you do a lot there. Not only looking at your direct vision in your eyeball, but y'all will also even do, like if you have like a little hooded eye. You
Certainly
can
we have
correct
oculoplastics,
that. Yeah.
yes.
Yeah, you can do everything. All right.
Retina,
Yeah.
glaucoma.
What's your advice to somebody who's been putting it off and thinks they're seeing okay?
I would say you don't know what it's like to see perfectly until you have LASIK, and it seems scary, definitely, the idea of a laser in your eye, but what I would tell anybody considering it is that it's not scary at all.
Yeah.
It's so fast.
You don't
It's
see
very
it, you
quick.
don't feel it, and
Over
it's
before
fast.
you know it, it's completely painless and very quick healing, quick results, totally worth it. I
remember.
couldn't be happier.
I can see clearly now. All right, thank you very much.